Well, good afternoon. In these unprecedented times, we must not forget for one moment that we're facing a ruthless, ruthless enemy. A terrible, terrible virus that is spreading around the world at an alarming rate, infecting people from all walks of life, overwhelming hospitals, killing thousands of people. And if we're going to beat this enemy, we need to remember that this virus doesn't travel on its own. It's people that help spread it. So when we stop moving, when we limit contact with one another, the deadly reach of this virus slows down. This morning, our Chief Medical Officer told all municipalities in Ontario to enforce self-isolation for people who have tested positive for COVID-19. Anyone suspected of having the virus and anyone in close contact with them. We have shown so far that we are fully prepared to take every action necessary to slow the spread of this virus and protect Ontarians. And we will not hesitate to take further action. My friends, the hard truth is, right now, today, there's very little separating what we will face here in Ontario from the devastation we've seen in Italy and Spain. Thousands of lives are at stake. And the actions we take today, what we do as a government and as a people, today will determine what we face tomorrow. And these next 2 weeks will be absolutely critical because we know a surge is coming. And it's up to each of us. It's up to every person in Ontario when that surge happens. And every week, every day, every hour, we can push back the surge of this deadly virus is another week, another day, another hour that we have to prepare. More time to get desperately needed equipment and supplies. And I've said from the beginning of this that we can't count on traditional supply chains. We can't count on global supply chains for this critical equipment. We need to mobilize Ontario's manufacturing might because there's nothing we can't make here in Ontario. My friends, there is hope because in these dark days, the Ontario spirit is shining stronger than ever. A week and a half ago, we launched the Ontario Together portal, and we put out a call to all Ontario businesses. We asked them to join the fight against COVID-19, and the response was incredible. We have an army of 14.5 million people all across this great province, hundreds of thousands of innovators and entrepreneurs who have the ability to make the tools we need to fight the virus. Innovators like Spartan Bioscience in Ottawa, who are making portable test kits that you can take anywhere and see test results within an hour. Entrepreneurs like Virox Technologies in Oakville, who created a disinfectant that kills the virus within 30 seconds on any surface. Pioneers like Thornhill Medical, who are making a portable ventilator, and they're doing a great job. Woodbridge, an auto parts manufacturer, is currently testing an N95 equivalent mask with Health Canada. And if they get approval, they'll be able to produce millions of these masks right here in Ontario. When you're fighting a deadly virus, these are the people you want in your corner. And today, we're giving Ontario businesses some more ammunition to beat COVID-19 and back up our frontline healthcare workers. The next steps in our plan to mobilize Ontario's manufacturing might is $50 million in a new Ontario Together fund. This fund will help factories retool their production line to make the items we need, like face masks, gloves, swabs, ventilators, and lab testing equipment. We've signed a deal We've placed an unprecedented order for 10,000 ventilators with O2 medical technologies. And the world-class manufacturers like Martin Rea, Magna, and Linamar. That's 10,000 ventilators made right here in Ontario for our hospitals that will save lives. My friends, this is a game changer, and we will keep going. I want our frontline healthcare workers to know that we have your back. Ontario's manufacturing machine has your back. 14.5 million people have your back. And my goal, what I want more than anything right now, is for Ontario to be in a position to support all of Canada. I want Ontario to be the manufacturing engine for all of Canada. We have a lot of work to do, and if we're going to get there, but I truly believe we will get there. I believe we will make what we need right here in Ontario. And then we're going to focus our industrial powerhouse on fighting the virus right across our great nation. So if you can make these life-saving items, if you can retool your business, your province needs you now, and your country needs you now. We have a long and difficult road ahead of us. We have some dark days ahead, but with today's announcement, we're going to ensure that we come out of this stronger and more united than ever. And together, we will beat COVID-19, because this is what Canada is all about. This is what Canadians are all about. Thank you, and God bless the people of Ontario. Now I'll turn things over to Minister Fedeli.
Thank you, Premier. The situation with COVID-19 is changing day by day. In these unprecedented times, we really do need all hands on deck. And the grit, the compassion, the ingenuity, and the strength of all Ontarians has been nothing short of inspiring. We live in unprecedented times, and we can all be proud of how businesses in Ontario have stepped up for their workers, for their communities, and for the province. From day one, businesses large and small have been calling, emailing, and texting, offering their services to help us in the fight against COVID-19. Spirits distilleries all across the province are stepping up to the plate and manufacturing hand sanitizers. Inksmith, a company who specializes in education technology, is now using their 3D printers to print face shields for our frontline workers. They're aptly calling them the Canadian Shields. They are also spreading the word across the province to other 3D printer owners to assist in the production of the headbands to attach to these shields. And as the Premier just announced, our government has placed an order with O2 Medical Technologies to produce 10,000 ventilator units by working with our advanced manufacturing sector. These incredible achievements are just a small sample of the kind of work underway right across Ontario. And now, more than ever, we need companies like these, from manufacturing specialists to the technology entrepreneurs, to work with us. Our job as government is to make it easy as possible for all of you. You have already heard about the Ontario Together website we launched a week ago Saturday. The response has been incredible. We have seen so many innovative proposals from organizations representing every facet of the Ontario economy. And now, to help businesses with successful proposals pivot quickly to manufacturing those critical supplies and equipment that we need, you heard the Premier, we are launching the Ontario Together Fund. We are providing one-time funding of $50 million this year for companies joining us in the fight against COVID-19. This will be available to companies and organizations across the entire province. It's designed to provide immediate resources to these companies so they can begin the work of retooling or building capacity quickly and efficiently. And we will be funding the most viable, innovative proposals that provide the greatest benefit to the people of Ontario the fastest. If you or your business has an idea, supplies, or the ability to innovate a solution to the COVID-19, please log on to ontario.ca/Ontario Together and submit your proposal. We will leave no stone unturned as we join together with Ontario's greatest workers and business leaders to fight the spread of COVID-19. As the Premier has said, we are all on the same team, Team Ontario, Team Canada, and the teamwork is going to be what gets us through these dark days ahead. It's teamwork that will ensure our healthcare system and our frontline workers, such as police officers, correctional officers, and social workers, are equipped with what they need to fight against COVID-19. It's teamwork that will make sure we all maintain social distancing and take the proper precautions so we can protect the health and well-being of everyone in Ontario. And it's teamwork that will help us build a stronger, even more prosperous province. Greatest place in the world, the greatest people in the world, as we work together to combat this pandemic. Thank you.
Okay, we'll go to the phone line for questions. First question.
First question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Fergie?
Rob, your line is open. Please go ahead.
Hello, Premier.
Hi, Rob.
Just wondering, you talked about the surge is coming. I'm assuming that means that you have a projection. So what and when can we expect from this surge when you're referencing Italy and Spain?
Well, we can't give you an exact time frame through our Chief Medical Officer of Health and our COVID-19 command table. We know it's coming over the next few weeks. Can I say it's tomorrow or the next day? I can't give you an exact time, but I know we're going to face it over the next few weeks, and we just want to prepare people to continue practicing social distancing, making sure they self-isolate, making sure people, as the order came out today from our Chief Medical Officer, if you do have COVID-19, self-isolate for 2 weeks, and the people around you have to self-isolate as well. You can't have a loved one in the house and you have COVID-19 and the loved one goes and goes out. That can't happen. That will just increase the spread. So over the next few weeks, we're going to face some turbulent waters. It's a race. It's a race against this virus, and versus making sure we get the ventilators, get the PPEs that we need for the frontline healthcare workers. So we just want to make sure people understand how serious this is, and we're out here every single day saying make sure we practice social distancing.
Okay, follow-up. I keep hearing from on email and text from nurses. They hear a lot of talk about getting new supplies, but they don't hear a lot of talk about delivery. So when are some meaningful deliveries coming for N95 masks, for surgical masks, for gowns, for more ventilators, for more gloves, those kinds of things?
Yeah, Rob, very good point. I hear the same concerns. Deliveries happen literally every single day. Shipments are going across the province. Shipments are coming in. I know there's a big supply coming in from the federal government over the next day or so. So as soon as we get our hands on those, we won't waste a second. We'll make sure they get distributed to the over 140 hospitals and long-term care homes, along with senior homes. We just have to make sure that we expedite this immediately, and that's exactly what our plan is.
Next question.
The next question comes from Cynthia Mulligan of City News. Please go ahead.
Hello, Premier.
Hi, Cynthia.
Today, the Toronto's Medical Officer of Health said that they have modeling projections on what they think the surge will look like here, what those numbers will be. She wouldn't give those numbers. I'm asking if you will. We heard what they are in the U.S. You have mentioned New York, so did John Tory, so did Dr. Davila. Is that what we're in store for? And can you give us the numbers on what people are fearing?
Well, Cynthia, I'm going to hand this over to the Deputy Premier and Minister of Health, Minister Elliott. Thank you.
Well, thank you, Cynthia. There are a number of different models that are out there that are being used by different groups. But I think what all the models indicate is that the next several weeks are going to be really critical for us if we are going to be able to flatten this curve and not have a tremendous increase in the number of COVID-19 cases and, unfortunately, deaths. So I think all of the models indicate how important it is to maintain that physical distancing, to make sure, as Dr. Williams indicated today, to the local medical officers of health, to ensure that people who have been diagnosed with COVID-19 are staying at home if they're able to be at home and not in hospital, and that the members of their family do the same. That is critically important for us to flatten the curve and to prevent our health capacities from being overwhelmed in our hospitals. So I think that all modeling suggests that, and that's what we're urging all Ontarians to please do.
Okay, my follow-up is for the Premier, please. Premier Ford, Dr. Davila today said that she is doing everything she can in her powers. You have even more power to shut things down while we're waiting for this surge. One of the things that she asked for is for the province to close more businesses that are at this point deemed essential. Construction is a big one. Why aren't you shutting down construction and more businesses to try and flatten this curve?
Well, that's being reviewed absolutely every day. I've said, Cynthia, we're going to be adjusting that list. You'll hear that in the next day or so. And let's talk about the construction out there. We had 300 inspections over the last few days. We've shut down 3 sites. We've sent out 160 orders to comply, and I won't hesitate to shut down any single site. We also have to keep in mind, once you hit one trigger, it affects 10 other triggers, and I'll explain it. There's thousands and thousands of people across this province waiting to get into their home, and I think I mentioned it the other day. I got a call from a couple saying that they have no place to live because they sold their house. They didn't realize this was going to happen. Their new house isn't ready. It's weeks away, and but again, if the sites aren't safe, we have hundreds of inspectors right across this province going into every site possible, and if it's not safe, they're going to be shut down. It's as simple as that. But we will be reviewing the list. We're going to be adjusting the list, and we're going to do everything we can to reduce that list. The supply chain is long when it comes to making sure we have food in the retail grocery chains. It's absolutely critical we keep that supply chain going, but we're going through it as we speak over the last couple of days to adjust the list there.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there.
Hi. Hi, Laura.
Premier, I'm wondering on the numbers in long-term care facilities. Yesterday, the Associate Chief Medical Officer of Health was asked about how many outbreaks there are in long-term care homes and how many deaths there are. She gave numbers that are much, much lower than have been determined by reporters. And she also said that her numbers are not up to date. How is it that the province's top health officials don't seem to have an accurate understanding of what is happening in long-term care facilities across this province?
Well, I'll pass that over to the Minister of Health. Thank you.
Well, we are getting that information on a daily basis. It's perhaps maybe because the deputy wasn't informed at that time of the exact number, but we do get it on a regular basis. We are very concerned about outbreaks in long-term care homes. That's a very, very vulnerable group of people that we need to protect, absolutely. There's more that we can do. We've got very strict requirements now with respect to no visitors except for palliative purposes. purposes, that the staff are checked on a daily basis, and that the residents are still being checked with some of our testing that happens for people who seem well. So this is a group of people that often have other physical problems who are very susceptible to catching COVID-19. We want to make sure that we can build that iron ring around both the long-term care homes, the retirement homes, and other homes and congregate group settings that house people that are particularly vulnerable, including people with intellectual disabilities. So it's a high target population for us to protect.
But shouldn't health officials have up-to-date information on this? And also, could you outline specific measures that are happening at Pinecrest right now? Can you comment on increased testing? How are people being isolated when there appears to be no room to move residents around? And also, can you address staff shortages? How are you going to increase the number of workers coming in when some workers are falling ill? And will you be increasing wages for personal support workers?
Well, first, just on the issue of the information itself, I can tell you that Dr. Williams, Dr. Yaffe, and others are in virtually all-day briefings these days, trying to present the information that they have to the public and to answer any questions. It may have been that in between, because this is a very fluid situation, that there might have been a change in the numbers, but certainly the information is available on a daily basis. Secondly, with respect to the movement and placement of people in long-term care who may need to be relocated, we are looking at other spaces. We're looking at hotel spaces, any other spaces that may be both accessible as well as appropriate for them to make sure that they are safely cared for. And in terms of increasing wages at this point, that is not something that we're looking at. We're finding that our frontline healthcare workers are doing a wonderful job. They are really the heroes in this whole system, and that's why we're facing the demand for, as we should be, for personal protective equipment, and that is what is occupying a good part of the Premier's time and my time these days, because we want to make sure, above all else, that our frontline healthcare workers are protected for themselves, for their families, of course, and also for their patients.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, just a question about ventilators. So when are we expecting the 10,000 to be ready? I imagine they'd be ready in smaller batches and distributed right away, but what time frame are we looking at? And if the next 2 weeks are critical, are they going to arrive in time?
Well, that's the race we're facing. I'm in constant contact with them. Linda, the CEO of Linamar, which is doing an incredible job, just a real true champions, leading the charge, putting their expertise behind it, their engineering expertise behind it, hopefully over the next 3 or 4 weeks. That's the challenge right now we're facing. It's a race against time with this surge that we're going to be seeing and getting these ventilators online. They're going to be coming off the production line, and they're going to go right into service immediately. But we aren't just standing still. We're working with companies like Thornhill. We're working with also manufacturing ventilators. We're working with the federal government. We're reaching out to companies across the world that have ventilators, and we're buying the 10s and the 5s and the 20s. So we're reaching out to everyone, and we're just going to continue moving around the clock as they are the O2 company that are working around the clock to make sure we expedite this as soon as possible. We're doing something that's really amazing. We put the call out about a week and a half, 2 weeks ago, and they're putting together a line that would typically take even upwards to a year. They're doing it in weeks, sourcing the parts, getting the line together, and there's no better person that I have more faith in than Linda, the CEO over at Linamar, leading the charge.
And to the health minister, have you or the command table have you actually seen any modeling that shows us the number of deaths Ontario could experience even if we flatten the curve? Has that number actually been charted? And will you share that specific number with Ontarians who obviously are watching our American counterparts get that number and jolting them into reality? A lot of people would like to know if Ontario has that specific projected death rate if we flatten the curve. Have you seen that number, and will you share that number?
Well, I can tell you that there are a number of different models that have been presented to us, and that the point of the model is really to help give you guidance on how to deal with the situation, which we are doing, and we are trying to flatten that curve every day. We can't predict right now what's going to happen because the model is just that, a model. We are dealing with what's happening in the real world. We have seen an increase yesterday over today that's quite significant. However, I think it's also important to note that we're still working on the backlog of cases that we had, and it was about 10,000 about a week ago. Right now it's about 3,100. So the cases that are currently being diagnosed are really historic cases looking back at what's happened over the last week to 10 days. What's going to be most important is what we're going to see when the backlog is cleared over the next day or so. We will then be dealing with current information, and that is what's going to tell us where we are in terms of flattening the curve, and the work that has been done by our frontline providers, who are doing an amazing job, but also by the 14.5 million people of Ontario. And that's why we continue to ask you to please, please stay at home as much as possible. Please go into self-isolation as you've been required by law now to do when you return to Canada. And if you've been diagnosed as a positive case and you're at home and not in hospital, you must stay there for 14 days, as must your family if they've been exposed to you. So all of that is what's going to really make the difference at the end of the day for all of us.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Thank you so much. These two questions for Premier Ford. Premier, I know you had just mentioned, as per Cynthia's question earlier, that you're reviewing the essential services or workplaces and businesses list, and there's more to come in the next few days. I'm wondering if you anticipate announcing changes to that list before the April 13th date, since there's been an extension to that list up until April the 13th.
Well, we're reviewing it every single day, Christina, and we're adjusting the list every day, and we'll be rolling it out. Minister Fedeli is heading that up, Minister of Economic Development, Job Creation. He understands that list better than any of us, but he's taking it seriously. He has a whole team, and we're going to make sure that we make those adjustments.
My next question, because Education Minister Stephen Lecce is not present, is for you, Premier. We have heard from a number of teachers after your announcement yesterday. One grade 8 teacher that contacted us says that the government's model for online learning is going to fail. He says it's an invitation for children to cheat and not get a meaningful result. And he says teachers want the time to be spent reviewing things the students have already learned and assessing why so many fell behind on their EQAO test. Wondering what your response is to that.
Well, I know the minister's #1 goal is to make sure that our students, our children, are continuing to learn on a daily basis, no matter if it's the TVO model that's out there or other models. We want to make sure that they continue to learn, and he's working hard to make sure we have a system that he feels comfortable, teachers feel comfortable, the boards feel comfortable. I can tell you with Minister Lecce, he just doesn't wake up in the morning and make a decision. He consults with all the stakeholders right across the board, and I'm sure he's listening today, and I'm sure he'll give you a call personally to follow up on that question. But he's taking the best advice from all the professionals in the education system to make that decision. I know he didn't make that himself. So he did get advice from teachers, school boards, school trustees, and other stakeholders.
Next question.
Next question comes from Mike Crawley at CBC News. Please go ahead.
Hi, Premier. Question for Minister Elliott. The trend over the past few days in the ICUs is showing a pretty sharp increase in the number of confirmed patients, confirmed COVID patients in the intensive cares. How concerned are you that this trend is going to continue and that the ICUs in this province are going to be overwhelmed by demand?
Well, it is something that we're keeping a very close eye on, of course, Mike. There are 145 people right now in ICU, 98 of whom are on ventilators. It's something that we are concentrating to make sure that we can expand our resources to make sure that as we see an increase, we're going to be able to care for those patients. But as I indicated before, that the increase in cases that we've seen over the last few days are really respective of a situation that was happening a week to 10 days ago, because we are still clearing the backlog. What's going to be really telling to all of us is going to be, once that backlog is cleared in the next day or so, then seeing the number of new cases that are coming in. We are certainly prepared for an increase. We are planning that capacity both in terms of the equipment, the hospital space, and health human resources. We have had about 10,000 people already who have volunteered to come and serve. That is from people who are retired nurses, for example. We've also got medical students who are helping us on the front line with the following up with the with the public health units out in communities, and we are monitoring all of that very closely. So the people of Ontario are stepping up, but we are certainly making sure that our hospitals have the equipment that they need, that they have the ventilators that they need, and the acute intensive care spaces. We have the 10,000 ventilators that are coming in, as the Premier has indicated, but we've also received a loan of several hundred more ventilators from cosmetic surgeons, dental surgeons, and so on, who are donating or letting us use their respirators in the short term. So we are receiving these pieces of equipment in on a daily basis, and we're following it very closely.
My follow-ups to the Premier, if possible. Premier, off the top, you talked about how important it is that the local health units use their powers to enforce that people who have confirmed cases of COVID-19 are in fact isolating. Do you have some evidence that there's actually people with confirmed cases out walking around in the public? And if that's the case, why didn't you order a crackdown on this sooner?
Well, again, we're taking our advice off our Chief Medical Officer on that issue. What we're also concerned about quite a bit, Mike, is people that are living with someone or in close contact with someone with COVID-19, to make sure that they follow the exact same rules as applies to people with COVID-19. And actually, I'll pass this one over to Minister Elliott, and she'll give you more information on that.
Well, this is something that we've only become more recently aware of as a concern, but Dr. Williams has issued a directive today, issuing his strong recommendation that the local medical officers of health use their powers under Section 22 of the Health Protection and Promotion Act to require that people who have been diagnosed with COVID-19 maintain that status and stay in self-isolation. This is going to be followed up on by the local medical officers of health, and there are significant fines for people to not do that. But I think the most important thing is that they will be followed up with their local medical officers of health to make sure that they are continuing that self-isolation.
Next question.
The next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Good afternoon, Premier.
Hi,
we've had Rob and Cynthia and Colin now ask about modeling and projections, and I was going to ask myself, and we still haven't been given any numbers. So why does it appear the government is hesitating in giving those numbers? You know, people know that this is a fluid situation, but they also want to know, you know, worst case scenario, what is the province looking at? So why is the government not giving the numbers that it's seen?
Well, as the Minister of Health mentioned, there's different models. There's a few different models, and if we pick one model over another, it sends really two different messages. Our message is very clear. We're going through some turbulent waters over the next few weeks, and we need to do everything we can to make sure that people self-isolate. We've been saying it over and over again every single day, because those models can drastically change. If we underestimate on one side and we overestimate on the other, and create a panic if we overestimate. But the facts is very clear. We're going through turbulent waters. We've been saying it over and over again. Make sure that you don't congregate. Last weekend, it was a little shocking to all of us that we see parks and beaches packed. We acted immediately, making sure that we brought through an order to make sure we close the parks and close the beaches. I don't know what more we can say outside of stay in your home, self-isolate when you can, go out one person at a time to go get your groceries. And if you have seniors, your parents or seniors, or if you're grandparents, make sure they stay inside. Anyone over the age of 70, stay inside. We just can't emphasize it enough.
And so the worst case scenario, the numbers that you have seen, are they worse than what you were expecting? Do you think that Ontarians will hear the number and think that it's worse than what they were expecting?
No, the worst case scenario can get bad. We were saying, and we've been very clear, we can have two ways to go here. We go the route of Italy and Spain, and we see the numbers over there, or we can take the other route, South Korea and Germany. And we all want to go the route South Korea has gone, making sure that people self-isolate. They don't spread the virus. As I said earlier on, the virus doesn't spread itself. It spreads being on people. And the further we can keep away and social distancing, practice that, the quicker we're going to get through this.
Okay, this will be the last question.
Last question comes from Marata and Thistle from Global News. Please go ahead.
Hi, thanks for taking my question. So Premier, we're hearing from people with loved ones at long-term care homes that are experiencing outbreaks that even though their family members are not testing positive for COVID-19, they're not allowed to take their family members out of these facilities to self-isolate with home care. And some people have said, you know, they're worried about their family members. There's one case where someone actually did become positive after their family was not allowed to remove them from the home. So I'm wondering, is this an order that they can't leave the long-term care homes to get care away from places where there's an outbreak?
Well, again, we put that order in that people can't go and visit their loved ones. I understand the question that they want to take them out. I'm gonna again pass this over to Minister of Health, and then I have a follow-up after this.
I think that what was happening before was family members were coming to the homes, taking their family member out, maybe taking them home for dinner or taking them somewhere else, and then bringing them back. That's why we've changed the rules so that people aren't allowed to leave the home. However, if family members want to take their loved one and have them join them, and stay with them, of course, they'll have to be cleared for COVID-19 before that happens, because we don't want them infecting their family. And if they want to do that, they can do that, but then they can't come back in during while COVID-19 is still with us. So I think what we were really trying to stop happening was a situation where family members were being taken out just for the day and returned.
Follow-up?
Yeah.
And you just this is the Premier, or unless you had a follow-up to the.
No, I was just going to follow up and speak, but if you have a follow-up question on health, I can bring the minister back up.
Oh, no, this one was actually for you, Premier, so if you want to go ahead and finish your answer, go ahead.
Oh, no, it's a separate item, please, if you have another question.
Okay. Well, this is also along the long-term care industry. We've heard from workers that they're actually being forbidden from wearing masks on shift. And so when we asked Dr. Yassi and Dr. Williams about this, they said the policy of it being mandatory for all healthcare workers in long-term care facilities to wear masks was under review. So I'm wondering, Premier, are you prepared to override Dr. Williams' directive if you're hearing from frontline healthcare workers that they do not feel safe on the job?
Well, I've been saying from day one, I take the advice of the Chief Medical Officer of Health and our health professionals. I understand it's difficult personally, and I don't overrule. I want to stress this. I listen to the health professionals. Are you safer with a mask? Absolutely, you're safer. I can't stand up here and say you wouldn't be safer without a mask. So, in my opinion, you'd be safer with a mask. But again, I'm going to stick with the advice from the Chief Medical Officer of Health and the health professionals that give me advice.
Okay, thank you.
I just, throughout this this time, I come up here and I talk about the Ontario spirit. The Ontario spirit, the companies around this great province are stepping up. I got a phone call the other day from the president of International Brands, a great company up in Newmarket. His name is Mark. Usually don't give last names, so I'll just say Mark, the CEO up there, called up and said, Premier, we have a donation for the province. And this is a big donation, 40,000 bottles of hand sanitizer. He says, I have 10 skids. Where do they go? This is what I'm talking about, companies stepping up. I was on a phone call today in one of the radio stations out by Bruce County, and Bruce Power, the CEO, got on and said they're donating 600,000 PPE essential items, be it medical gowns, face masks, gloves, hand sanitizer. That's probably one of the largest donations we've had from Bruce Power. We thank you. And I have to say, keep it coming, because with the power that these companies have, we're an economic powerhouse around the world. They're stepping up and supporting the cause. Another shout out that I want to do that doesn't get very much recognition at all, but shows up every single day to help with sign language is Christopher behind me. And Christopher, do you have a minute for just to come up here for 1 minute? I apologize. You can take over the sign language, but this gentleman shows up, never complains, never says a word. And I told him today how many comments and emails and phone calls I get about you. My friend, you're a champion, you're a rock star, helping people in the deaf community, and it's so important, the role you're playing. And I was told today that moving forward, you're no longer going to be with us physically here, but you'll be with us as a team. Is that right?
Yes.
Great. Yeah, go ahead, please.
Absolutely. So I will still be part of the team, and I may be behind the cameras and supporting the interpreters that are here. But what we're trying to do is we're trying to make sure that all deaf Ontarians have access. And we're moving to include deaf interpreters. And deaf interpreters make sure that including deaf children and deaf adults and everybody can understand the message clear to keep themselves safe from COVID-19 and be able to follow the very important messaging that Premier Ford is sharing with us. So we will be changing a little bit, but I will still be in the building.
Well, thank you so much for your service. People like this, like Christopher, real champion, stepping up, never complaining, day in and day out. One more shout out. The people that work in financial institutions. You're going in there, we haven't mentioned them yet, but they're dealing with you day in and day out, making sure that the economy is flowing, the money is flowing, and they're sitting there at the teller's booth, and I want to thank them as well, and thank all Ontarians. Thank you, and God bless. Thank you so much, folks.